Whoa, whoa, wait. What? Didn't you know? There's contamination in this water. Got it. Delicious.
Hey sir, I'm Dr. Know-It-All. What seems to be the problem today?
I have a little bit of cramping right here.
Okay.
Mainly, I've been having like diarrhea like 3 times a day. Just watery diarrhea, and no blood. It's just kind of like just water and yeah, it hurts.
I see. Okay. When's the last time you had anything to eat or drink?
I have a normal diet, you know, just sandwich and just about to have some dinner soon.
Okay. Are you on any medications right now at all?
No medications, no.
Do you have any pre-existing medical conditions? Any surgeries you've had? Anything like that?
I've been fighting the flu for the last couple days, but that's it, yeah.
Okay. Have you traveled outside the country in the last 30 days or so?
No,
Okay. Any fevers? Any night sweats? Anything else that you can think of?
nothing, no, other than that, healthy.
Okay, so you're saying you're having pretty consistent diarrhea. What I'm going to have you do is take a stool sample.
A what?
All I'm going to have you do is poop in a cup, and I'm going to take it off and make sure that it's run through the lab, and we're going to do some tests based on that. Because you're losing so much fluids because of your diarrhea, and you said no vomiting, right?
No vomiting.
Okay.
But give me the cup, I gotta go now.
Okay.
Out of my way, move it. Oh, nurse, here's your stool sample.
Well, that's usually a smaller sample than what we're used to, sir, but I think we'll be able to get all the information from it that we need. So I'm going to take this to the lab, and I'm going to have a couple of tests run, and we'll see where we go from there.
Okay, thank you.
You're welcome.
After running a couple tests including a gram stain, it turns out that Jake has ingested a gram-positive bacillus-shaped bacteria that produces spores. Because his symptoms included cramping and multiple watery diarrheas a day, the main culprit of his discomfort is an infection called Clostridium difficile, or C. diff. There are typically 2 forms of C. diff. One is the inactive or non-infectious form called the spore, and the other is the active and infectious form that releases the toxins. We know that from class that the spore can survive in the environment for long periods of time. C. diff bacteria can be found in soil, air, water, human and animal feces, but most commonly found on items in the hospital or nursing home surfaces such as toilets, tools, chairs, and bed rails. Because C. diff spores can survive for many weeks on surfaces, if they're not properly cleaned, the spores can be transferred easily to anyone who comes in contact with the surface.
Oh, how did I get this?
That's a very good question, Jake. So the portal of entry for C. diff is the mouth. However, the contact does not have to be direct. The modes of transmission to another person is usually through the fecal-oral route, contact with contaminated hands, contaminated fomites, or contact with contaminated vectors like flies, or by direct contact with an infected person's feces.
Feces? Oh my gosh. Okay, well, how does it work? Why am I sick?
Oh, Jake, you're so curious. So when the bacteria reaches your gut, C. diff will settle into your intestinal lining and begin to colonize rapidly. Because your immune system is already suppressed from the flu, it will start to produce toxins, and your body's response to that is by flushing it down constantly with water, which is why you have diarrhea. It's your body's way of getting rid of all that good stuff.
Oh, that is good stuff. Can you send the doctor in here so she can explain to me how I'm going to treat this thing?
Sure thing, Jake, but let me give you a couple numbers first. Between 1993 and 2009, the total number of hospital stays for C. diff treatment quadrupled from 85,000, reaching its peak to about 350,000 patients in 2008. Their most recent outbreak occurred in just 2012 at the Royal Victoria Regional Health Centre in Ontario, Canada, which 9 cases were reported within a 3-week period.
Hey, sir. So your test results came back, and you are positive for C. diff. What that is what that means is that I'm going to give you a round of oral antibiotics. Have you ever taken antibiotics before?
Mm-mm.
Okay. So I'm going to give you a random dose for about 10 days, and even if you're feeling better or so within 3 or 4 days, I still need you to complete your course of antibiotics, because even though you're feeling better, that might not kill the germ specifically that we need you to get rid of, even if you're feeling better.
Okay.
So you might feel a little icky the first couple of days, but other than that, you should be fine, and you shouldn't have any returning symptoms after this. If you do, make sure that you come back in and see us, and we'll undergo a stronger course of action and discuss some other antibiotics or some other treatments at that time. But for right now, I don't need you to worry about that. We're going to finish this round of IV fluids that we're giving you to replace some of the fluids that you've lost. I'm going to get your antibiotics going, and you should be feeling fine in a few days.
Okay, thank you.
Yeah, you're welcome.
Well, thanks, Doc. I feel so much better. It's been 10 days that I've been on the antibiotic, and I'm feeling a lot better now. I do have a question, though. I don't want to do this ever again. So what can I do so that this doesn't happen again? Well, I can help you with that. There's 2 main ways we're going to help fight C. diff. First is contracting it in the hospitals, and second is the reoccurrence. Okay, so the first thing we're going to do is we're going to want to stop C. diff altogether. And as you know, it's fecal oral, so it's going to get from feces to the mouth somehow. And our main concern is going to be hand touching. The number 1 transmission is hand to mouth. Now, whether that's through water or tools or food, something happens where hand to mouth. And what we're going to do is we're going to use just soap. Plain and simple soap is going to wash all those spores away, and they're going to go down the sink. It doesn't kill them, but we're going to prevent the spread. Second thing we're going to do is we're going to use bleach. Bleach will actually kill the bacteria. Studies show that just by doing the topical surfaces of benches or countertops with bleach will kill 75% or reduce 75% of the infections. Okay, and the second thing we want to do is prevent reoccurrence. Now, 25 to 30% of patients with C. diff will have reoccurrence. Now, there's some interesting new developments that we will actually give patients the spores of C. diff that are non-toxic. And what that does is, if there is going to be a reoccurrence, it will be with spores that don't give the patient diarrhea, and so that helps with the symptoms. So the interesting thing about C. diff is that it's caused by the main cause is when patients are on an antibiotic, and the C. diff is actually in their normal gut, and it's able to replicate more, and when it's replicated in massive amounts, it releases a toxin. Ironically, our number 1 and number 2 solutions are antibiotics, and only one is approved by the FDA, which is vancomycin. There's been a lot of discussion about probiotics. However, there is no conclusive evidence that it actually works. Some small scale studies show that it does work, but the much larger scale studies show that it's not as effective or effective at all. Well, thanks. This has been so informational. I hope you guys all learned a lot.